I wanted to become a professional soccer player. I wanted to become actually an architect and ended up as being a dentist. We're not producing cars, we're not producing radios. We are trying to provide oral health and care. What you mostly learn out of this is never give up.
What's your vision of dentistry in 10 years from now?
I do believe becoming a dentist will become even more attractive in the future than in the past.
How do you look at digital dentistry and especially, let's say, extreme developments that we see now in robotics and navigation?
Again, I see this as a very positive development, and the ones which see this as a threat, they will die out.
Welcome to ProTalks, the Pulse of Dentistry. My name is Raeber, and together with my colleague and friend Andreas, we are very pleased to host this series of inspirational talks. In this podcast, we are going to engage with remarkable personalities in dentistry. And the goal is actually to get together with them on their journey of development, to live together with them their pivotal moments in their careers that made who they are today. And of course, it's about talking about the future and the future of implantology, the future of innovation, and particularly also the development of technology and what it will bring to patients for tomorrow. So in essence, it's about talking about the future of dentistry with leaders, thought leaders in dentistry. And today I'm very pleased and personally honored to welcome Professor Dr. Ronald Jung here with us. Welcome, Ronnie, to Basel.
Hello, George. Hello, Andy. This is for me really a privilege to be together with you guys because we share a lot of years together and a lot of moments which really shaped our way out as we are today. And I'm very thrilled to spend this podcast with you.
Yeah, Ronnie, it's a great pleasure to have you here. And introducing you is on one hand very easy because you're such a known personality in our field. But on the other hand, it's also very difficult because you have such a long list of incredible accomplishments in your career. So you're a trained prosthodontist, you're in implant dentistry, you're also an oral surgeon. And after the initial years, actually, we met for the first time really in, let's say, San Antonio, when you were a visiting associate professor with Professor Cochran. And we had a lot of time to discuss about implantology. We as a company started to develop the bone level implants, and you gave input about the surgical protocols. That was very remarkable. And I also remember the after work drinks after long days that we had together. Then your next step was actually in 2008 that you finalized your habilitation. Then already in 2011, you got a PhD from Akta University. Just shortly after, you had your second stint actually in the US. So this time you were at Harvard Dental Medical School. And then in 2015, you got a full professorship in Zurich. And now in 2022, you're ordinary professor at University of Zurich, and you're chairman and clinical director of reconstructive dentistry. It's a remarkable career, and it has been a great pleasure actually to be, very close to you and see you progressing. I know you as a very scientific person. I mean, together with your team, you have close to 400 peer-reviewed publications, and to say this, you still have 1 to 2 decades to come. So there is plenty of more opportunities for you to actually publish. But you're not only a scientific person. I think what really is important to you is translating this into actions that dentists can use the next day in their clinical practice. And having seen many of your presentations at congresses, it's astonishing how enthusiastic, energetic, and also close to patient you actually are. And there is always something to take home with from your presentation. So you're really someone that can translate science into clinical impact in practice. And besides that, you have had a number of leadership positions in the last couple of years. And just to name 2, you have been president of the EAO from 22 to last year. And during your term, I think we can say that you really brought the EAO to the next level. And now you're president-elect of the ITI, and you will start your presidency actually this year. So, Ronnie, we make it a habit to actually start these podcasts with the first question, which is always the same to our guests. And we would like to ask you to introduce yourself in just 1 minute. So, who is Ronnie?
Thank you very much, George. It was an excellent summary regarding that. It was nice to listen to that. So for me, when I try to summarize myself, it's not that much about the career steps I have achieved. It's more about people, and it's more about the passion for what we are doing. And for me, it is most important that we can really share this passion on an everyday basis for what we can do, because we have the most privileged job. We can treat human beings. We can make their life changing, and this is what makes me every day really so happy. And this is in a 1 minute say, it's just I'm an extremely positive, passionate dentist, and my mission is really to share this passion for so many people and inspire them for their life, and hopefully treat more patients with better treatment over the years.
I can absolutely confirm this. I mean, you're such a passionate person, and whenever I see you interacting with the crowd, I think this is really where this is where you live up to your highest level. And I think this also makes you so important for the field, because you can transmit the science to more and more people, and by this also advance the field, and hence patients are actually then profiting from it. When you reflect on your last 2 decades in dentistry, I mean, we've heard that you had a remarkable career, but can you share a little bit what have been the most important moments in your career where you had to take a decision actually to go left or right, and this decision made you the person who you are today?
I love this question, because a lot of people think when you listen to Ronnie's career that everything is meticulously planned. And I can tell you the truth, nothing which I ever planned have worked out. Starting very early, I wanted to become a professional soccer player. I wanted to become actually an architect, and ended up as being a dentist. So I think for me, what I have learned and what I would like to give further is the fact that you always should stay agile, you should stay curious, you should stay interesting. And I don't believe that I'm just made for dentistry. I think when you have a personality which you're really passionate about what you're doing, you can be successful at many places, and it's the attitude how you approach things, and this is, I think, where the secret is, and this is why I loved doing it every day. But I never really planned the steps. I just stayed open, and when it was there, then I used this as an opportunity, and this is how I actually this is one pattern which was really, it's very true in my life.
You just mentioned your sports career, and maybe let's go back to this a little bit. You shared a story which I remember very well. It's from your time where you played for GC, so the Grasshoppers Club in Zurich, and you were on the track basically to become a professional soccer player, and you played for many years with that club. You also were not so fortunate with injuries, actually, I remember, but the story goes like this. So you had to do a track race, basically up a hill, up a mountain. And the goal setting was, reach that bus as fast as you can. So there was a bus up the mountain positioned, and everyone actually started to race up the mountain. And then midway, I guess you just realized that the bus wasn't stationary; it was moving. So it was one of the settings of your trainers to create this sense of, well, things are not as they might seem to be. What have you learned from those kind of experiences in sports that you now also apply in your daily life?
Thank you so much, George, for bringing that up. I think you had a great memory, because that's true. That's really was a story which we once shared together. And I think it's a perfect example in order to how you should shape yourself when you really want to do in any way a kind of a successful career. It shows that you can never rely on really a goal which you have there, because that target always changes over the time, and what you mostly learn out of this is never give up. Never give up. This is the main thing, because nothing in life is often everything which is too easy is often not the real success. And I think I learned from that, number one, that you always need to stay sufficiently agile in order to manage also different setups, to manage different changing targets, that the goal changes. And when you're too focused on one thing, it goes a little bit back to the question which we had before. When you're just too focused on one thing and you're just dedicated to that, you might lose another opportunity because you're too focused. So that means I need to calculate now in this particular situation my energy to a level that I still manage to reach the goal. When others, they have just calculated their body capacity to reach that first defined goal, they won't get it to the other one. And this is what I have learned. Also, never give up and try to really stay open and try to be able to still adapt in each situation your style to the current situation.
So speaking about being or staying agile and managing your energy well, what you just said, how do you manage your energy today? I mean, I know you are very present whenever you are in the room. You are very energetic. You work hard. You travel a lot, and all of this is draining energy. But still, I experience you always as a very energetic person. And when you enter the room, you always leave energy in the room. How do you manage your own energy today?
As a number one, it starts everything from this passion, because I really love what we are doing, and I think that creates so much energy in your life. Number two, for me, I have learned over the years that about 98% of my happiness comes from the happiness of others. So therefore, I engage really with other people. I never need time for me. So when I'm with friends, when I'm at the university, when I'm having dinner somewhere, when I'm with my family, then I'm always fully in that environment, and I'm not distracted by anything else. Then I'm fully in that environment. So I never do anything halfway done. So that also means that you will never see Ronnie relaxing on a sofa, because I only know two conditions in my life: either to be fully active or I sleep.
To be asleep.
Yes, there's nothing else. That's why driving a car by myself is for a long distance is a nightmare, because I literally fall asleep there. So it's really dangerous. Therefore, I need to constantly be interacting with someone. Exactly.
That's very interesting, and I think, Ronnie, that's an amazing skill to have, to be really present in the moment. I think a lot of people are struggling with this, and I think it's the really great leaders who manages to stay present in the moment and really be attentive to the person they are speaking to. And people realize this. We spoke about your career, and George asked you the question about, what have been pivotal moments and important decisions. And we all know that, there are people that make a difference to all of us. Everyone had a mentor at one point in time. Who was your mentor or your mentors throughout the last 20 years, who you would say had a big impact on who Ronnie is today?
Mm-hmm. I like this as well. And I can just tell you, I'm not a person which is just following kind of one mentor. I think that's maybe also me. I try to pick from different, really unique and admiring personalities certain parts, and that made me the person I am. And when I chronically look back, people which really were very important for me, number one, it was Professor Peter Scherer. This was the professor which actually brought aesthetic dentistry and all ceramics into dentistry. From him, I learned the dedication to really perfectionism on the level of aesthetic dentistry. Then Christoph Hammerle was the successor of Peter Scherer at our department, and from Christoph, I learned really kind of a very structured approach and on the research activity. So I learned a lot how to really meticulously plan and structure kind of research plans. And then another inspiring person was David Cochran when I was in San Antonio. From him, I learned one thing, and I love sharing this with you guys. I was once in his office, and he told me, listen, Ronnie, I'm sick and tired of people with good ideas. What I need are people which are finishers. And that is so true. That is so true, because you come to a level. Also now you see that as well. People coming and everybody has a great idea, and you start to become tired about these great ideas, because at the end of the day, a great idea doesn't change the future. It's the ones which really bring this idea into reality, as that's what you want to see. So that's what I have learned from him. Then Klaus Lang was also somebody which inspired me. He always considered me being his grandfather, because I was like his academic grandfather. And Klaus, what I really love is how passionate you can be also far past his retirement, how much he engaged with postgraduates. It's just, for him, it's a true pleasure to sit together with postgrads discussing literature, and behind every study he can tell a story. And I think that's also something which inspired me, because I think at the end of the day, to engage with the audience, you need to tell stories. It's not about the facts. You need to embed the facts into a story, and this is what people can learn about, and that's what they capture there. And another person which is really also very important for me is Danny Boozer. And Danny Boozer is for me just a wonderful example of really a person with enormous amount of energy, and he really gets the things done. So he was never kind of somebody which was just talking and nothing get done. He was an absolute doer, and I think that's also something which I like, and I think the combination of all these personalities made me also a little bit the person I am.
Okay. So a lot of very inspiring personalities that you just mentioned, and a lot of advices you got probably throughout the last 20 plus years in your career. What is the one advice that you did not get, and you would wish to have gotten, let's say, in your early 30s in your career, looking back?
This is a very difficult question. This is now we have that's you got me, Andreas. I never thought of that. I wouldn't say I regret anything, or I wouldn't say I missed any advice from that point of view. Obviously, we could spend another podcast just on Ronnie's failures, and because I did many failures and many mistakes also in my life, and at that moment, yes, you do regret having taken that decision. There can be small things, there can be bigger things, but I don't see these as failures, because what I think in life is that everything happens for a reason. It's also things which are very, which touched you very much. At the end of the day, it always opens other doors, and it makes you at the end stronger. So therefore, I'm not the person regretting having done things. I'm more the person trying to take this up to the next level and make it even something positive. And therefore, I cannot really say what I have regretted regarding the decision. There would be multiple, but at the end of the day, I try always to convert this into something even better than when it would not have happened.
So you had a lot of mentors, very strong, inspirational mentors. What would be the advice you would give to someone, let's say a student of you that is in his early 30s? I think that's another way to put it.
Mm-hmm. I think number one is, again, try to really love what you're doing. I think that's the main thing, because that creates so much energy and that makes you so much better in everything. Number two, don't take yourself too serious. I see this now, also the older I get, too many people take themselves too serious. And the problem is, you spend too much time on trying to be amazing, look amazing, act amazing, whatever. And this time is missing for really becoming disruptive, innovative. So you shouldn't take too much care about yourself. It should always be about the vision, wherever you are, whether it's a vision within the university, whether it's a vision for an organization, and try to spend as little time with yourself. Just invest this energy into the task you want to do. And number three, I think, again, taking everything as an opportunity. Don't stress yourself regarding decisions, because also every decision can be changed. So I also have 4 kids, and it's have so many opportunities, and I think it should be a pleasure to take decisions and not a threat. And I think this is what these 3 things I would like to give to a young generation.
Yeah, that's very good advice. That's very strong advice, and also, as you said, Andreas, I think also what you mentioned regarding your learning from mentors. It really, I can see this in you. You know, you're so energetic, and you're also so passionate, and you're seeing the opportunities. You don't see a failure. You see another door opening, and you are courageous enough to open that door. And I think that's, in the end, maybe from seeing from the outside, it looks like a very continuous movement that you have made to the positions that are in today. But actually, I believe it's a lot of mental work also behind that. That defines you. Now let's switch gears a little bit and talk about dentistry. So, I mean, who to ask about past and future of dentistry than you? You're a very innovative person, together with your team. And looking back a little bit, for you, what have been the most striking innovations in the last decade in dentistry?
I think, as a for sure, everything which is related to, that's getting boring, but related to the digital world. I think that is definitely the thing we have striked a lot. When we become a little more concrete and looking back to my environment there, I think the diagnostic part, which became more digital and more being able to visualize this, has become a very important step in dentistry. And this also on the level of the point to put the patient into the center. We're dentists, and we love technology. We love treating with our hands, but we sometimes forget that the most important part is actually the patient.
It's about
human
patient.
And so I don't see these advancements primarily just to make myself a more successful dentist, to try to engage the patient more, to try to make the patient more confident about what we're doing, to try to provide the patient also with more information, and that leads to a better expectation management, at the end to a more happy patient with what she or he gets. And I think there, the digital approach has really changed our way of treating significantly. Now, on a technological base, I think one very important step in when we focus now on implant dentistry is, for me, really the rock solid development there, because that was maybe one of the major changes for me as a dentist, because allowing to become less invasive with the same strengths, that is something which really has changed a lot. There have been many modifications, but there were not kind of major changes there. So for me, things are important which opens, on the one hand, more opportunities to reduce the invasiveness of the patient treatment, and number 2, to provide more patients with better care. And meaning to reduce invasiveness also opens the opportunity that not just superstar dentists can provide the patient with a good treatment, and that's something which I'm really very passionate about.
That I can relate to very well, and there have been a lot of internal efforts to get to that point, also to do a material development in a dental company. It's not common because the volumes are very, I would say, low compared to other industries. But we actually, managed to do this, and I think that was also a significant breakthrough. Now, talking about breakthroughs, I'm also very scientifically oriented, and I believe that scientific breakthroughs, they need to be tested and proven. And a lot of this actually happens with clinical trials. Now, on the other hand, dentistry has become so successful that we have success and survival rates. If you compare this to other medical fields that, orthopedics, for example, they could dream of, or other, let's say, medical fields they will never reach. And I feel a bit the tendency that nowadays scientific data, particularly also clinical studies, they become less and less important, and a lot of companies, they also bring products out without any clinical testing. You have also been very strongly involved in a lot of the clinical testing of products. What would you say to people that are, seeing that trend and saying that, well, in dentistry, we don't need a lot of clinical evidence anymore?
I'm confronted a lot with this question, obviously, and I agree with one part that I think the whole instruments in order to analyze a new development and test and improve and scientifically prove a new development, a new device, a new technique has changed. So in the past we were very rigid from that point of view. You had a kind of a randomized controlled clinical trial, and this was the tool which you tested everything which was coming there. And I strongly disagree that clinical trials are not important anymore. I think they're even more important in the context today because more dentists are providing also implant dentistry. Therefore, their understanding goes only through clinical trials. But I think what has been changed is how these clinical trials are being designed. And I think it's not that rigid anymore, just one design. At the end of the day, today, when we look at successful research activities, it's like an orchestra with different instruments. And to be successful, you cannot just be the most amazing piano player. You need to play multiple instruments. And one of these instruments is a clinical trial, but there are many other opportunities which we have today. And I think that's also meaningful because in order to reduce the invasiveness also from that point of view. And in this context, especially data science came into the field which already did, but will even more revolutionize our understanding for new developments without really lower the benchmarks of what a development needs to be in order to be treated in the patients. And I think it's very wrong because again that we are in a time period where things need to move on very fast. But that makes also other companies less and other companies more successful because at the end of the day, when you manage to put the patient again into the center and understanding that this is the most precious thing we can deal with. We're not producing cars, we're not producing radios, we are trying to provide oral health and care. And therefore, I do believe clinical trial will still be always in the center of developments, but you need to play many more instruments.
Now, to try to connect those two elements, so you spoke before about the importance of the digitization in dentistry, and now we talked about clinical trials, and I mean that also leads to peer-reviewed publications. Now, how do you see this, Ronnie? So the advancements in digital technology is so fast-paced that it outpaces basically the frequency of a peer-reviewed publication. So often you write a paper, you submit it, and it takes a year or maybe 1.5 years until it gets published. In this period, the software has already turned over 3 times. So how do we connect those thoughts of acceleration in digital dentistry and science-based decision-making?
I think that's a very important question. And I think I fully agree with you. The traditional system of publication is actually not anymore the way to communicate this information. And I think this is a true challenge and also a threat for all the traditional publishers because they stick too long. They now start to really move on, but I think we are there still not at the level where we should be in terms of the time between a development or an information and then the communication to that. I think the traditional way of publication is not anymore the way of how things should be communicated today.
Mm-hmm. And you see there a movement, so you see change and you see solutions to that?
I mean, the major publishers in dentistry, they are very much under pressure to move on there. And I think they are doing, but this is like every company which needs to get out of their comfort zone and going to another level. They do struggle, but I think they have really been waken up and they are aware that this is a huge threat for them.
Mm-hmm. Yeah, that's going to be interesting to see how that evolves, because also for us it's very important to be at the forefront, understanding also what comes out of the science, but then not 1.5 years too late. Now let's look a little bit more into the future, Ronnie. So what's your vision of dentistry in 10 years from now? How will it look like? How will your job, the job of dentists, or also what type of care patients get in 10 years look like?
Also, number one, I have good news. I do believe becoming a dentist will become even more attractive in the future than in the past.
Okay.
Because I'm very convinced that through all the developments, through all the digitalization, through all the optimization which will also happen in dentistry, the dentist's job will become a more responsible job for the oral health. And it is far still underestimated the impact we can have as dentists in order to provide patient with a good general health. And I do believe that we will have a strong shift from kind of more hand workers, crafters, into really medical doctors with a specialization in oral health. And I think there are so many opportunities which are in front of us, which just thinking of it makes me really so happy. And I think this will be a change taking place on many levels. This will start, we will change, and we are already the response for undergraduate education of the entire dental school. So we will have also changes of the curriculum in order to get close to the medical faculty. And at the end of the day, my dream, my vision would be that dentistry becomes again part of the normal medical study, and we become then a specialization later on. I know many don't want that, but I'm very strong about that this needs to be the way how to really be able to get full potential of our ability within the oral cavity to provide patients lifelong with a general health.
So you're also alluding to personalized medicine, so taking the patient into the center, and I know that you're a big proponent of personalized medicine also in dentistry. Can you give us a bit of a feel for how will personalized dental care look like in the future?
I'm getting very passionate about that. I'm even getting bored about how we treat patients actually today, because we have so limited possibilities to personalize it. Human beings are so much into, they like having a certain rhythm, and they do things because they are in the comfort zone. And as we said before, in order to really be disruptive, innovative, you need to get out of your comfort zone. I don't need the comfort zone. I get every morning at a different time point I get up, so I have never a rhythm there. So I try to stay also from that point of view agile. And that the personalization is only possible through a better understanding of the data. That goes from that point of view. So without the data, we will not be able to get further in terms of personalization. And I think there are so many opportunities, because we try to treat millions of patients with very limited amount of devices, with very limited amount of information, so to say. But we do this because we did that for many years. And through the better understanding of the patients and general health and oral health status, I think dentistry will become again more responsible for the oral cavity and not just providing devices. And there is one USP in dentistry which no other medical discipline has. Dentists see the patient over a very long time period. That means sometimes even a lifelong period, that your parents have been at that dentist, you go into the same office as as a child, and then my kids go into the same office. And this gives a huge opportunity to really follow up these patients in a very precise and very continuous way. And this opportunity we need to take as dentists.
And maybe there is another opportunity that is quite unique to dentists, I think. Who owns saliva diagnostics in the medical field right now? And I believe dentists are the closest to, let's say, saliva. And, saliva is said to be the new blood in also analytics and personalized medicine. So maybe also there is a very interesting future for the field of dentistry.
Yeah, absolutely.
Bonnie, I love your vision on the future of dentists, and that it's even more exciting to be a dentist going forward. I really like this. I'm passionate about this as well. And also, by the way, dental technicians, I'm sure, it's going to be very exciting to be a dental technician in the future, seeing all the advancements that we see today. Let's speak a little bit more about, let's say, technology advancements that we see in your vision. If you think about dentistry in 10 years from now, what we hear often is, everything is innovated, that there are no major innovations to be expected in implant dentistry because everything is there and everything is working so perfectly well. How do you look at this statement?
I think it is partially true, obviously, that also in implant dentistry per se, we did not had the major changes because we have really a boost was taking place about 20 years ago, and we just kind of became better and better in what we are doing. But the huge innovation was initially to provide the patient with a fixed reconstruction in areas which they could never have fixed reconstruction. This was a true patient benefit. And I think implant dentistry becomes then interesting for the future when it is again embedded into a more holistic concept when it comes to the patient treatment. So I always say I don't treat missing teeth. I don't treat teeth which have a defect. I treat human beings. And we need to see implant dentistry embedded into the overall concept and trying to provide these human beings, and I don't see them even not as patients, as human being, with care, starting with a well-being, with a general health situation, and obviously to replace these missing teeth. And I think this is to embed this into this concept. That's, I think, it's the most important part, and that's why also I do believe that the general practitioner becomes really an important person within the overall field. And this general practitioner, she or he should become really much more knowledgeable also about the general health issues. And specialists, this is what you see today, is getting so narrow and treating a lot of very complicated or cases which have even complications. I think there we have switched. That's why it will be the gap between a specialist and a general practitioner, I think, will increase over the years. And I see a lot of importance for the general practitioner taking this responsibility. And the specialists, they are more dealing with really the highly complex situations and complication cases.
Yeah. Let's move a little bit into digital dentistry in general. You mentioned it already before, Ronnie. How do you look at this? I mean, digital dentistry is moving very fast. I think a lot of dental professionals are challenged by this and, also even feel the fear to become obsolete at one point, which I don't think we agree to. But still, how do you look at digital dentistry and especially, let's say, extreme developments that we see now in robotics and navigation?
Again, I see this as a very positive development, and the ones which see this as a threat, they will die out because this is the same thing like with other industry areas. So you need to stay agile. It goes back to what we said at the very beginning. And again, the dentist, and again, the focus, again, have now on the general practitioner, they need to stay agile and they need to learn to take more responsibility for areas which we haven't been able to look at. And this is more than the general health point of view and the saliva diagnostics, as George said. So when we look back 100 years ago, why did the dentist have been separated from a normal medical study at university? Because there was so much to do. They had so much decays and caries that everything was a waste of time, because each time the patient came back to visit the dentist, they had 2 or 3 more decays to fill. So their job was just to run after the caries, and therefore you were focused on the very kind of technical aspects of dentistry. And now the pendulum swings back, because we do have, and we will not be able to escape this optimization and the robotic part. I tell you how I got into robotics. A good friend of mine, he's a Swiss pilot, and he flies the Boeing 777. And I was asking him in 2018 how much time he flies by his own. And he said from a flight from Zurich to Sao Paulo, which is about 12 hours, he flies 6 minutes. When the weather conditions are bad, it's only 3 minutes, because it's only taking off. So just to take this into consideration, that's an airplane which has about 360 passengers, which the conditions change every part of a second, and the forecast is very difficult. And we in dentistry, we have so many more steady conditions, things which can be much better planned. But many dentists, again, because of this fear, we hinder further development because we are afraid of our profession. But the contrast should be the reality. We should be curious about what's going on there, because it opens opportunities which we have not been seen before.
I think that's a beautiful way to put it, Ronny. It's not a question, what can I do as a clinician, or what can the technology do, but, how can the technology support the clinician in his daily work and daily practice in delivering, let's say, ever better clinical performance to his patients. I think it's the combination of both that we need to look at, and I think that's also the way we look at technologies like this. How can we help experienced clinicians to become more efficient, and even more consistent in their treatment quality, and how can we maybe also help, let's say, learning clinicians to learn faster? I think that's a beautiful way to look at. Now, looking into the future is not only, how the dental profession looks like and how technology look like, you also have to look into your, let's say, work future. You have a big project at the University of Zurich ongoing, and I know you're one of many people that work on the vision and building this there, a very exciting thing to build. And we do kind of the same at Straumann. We are building a big research and innovation center in Basel as we speak. And I think the challenge, and George, you put this very nicely in our preparation, is the challenge is always, you build something today, but you have to build it for the future. So now the opening will probably be in Zurich in 2030, but you have to build it for dentistry in 2050. How do you approach this?
Yes, this is definitely one of my most exciting projects, because it combines what we discussed before. So I approach a new building. A new building needs to be just a facility of the goals we would like to achieve in 2050, for instance. This was actually the task. So we did a lot of workshops beforehand, also with other disciplines, with the ETH, in order to try to mimic and simulate dentistry in the future. And this information was then transferred into the building per se, and this is the current situation. So whether we are right or not, that we will see. But I think we managed to get also there a building. It's a pure wooden building with a lot of solar panels. So we tried to kind of combine a very sustainable type of construction with high-tech dentistry, and the inner part of the building is organized in a highly interdisciplinary way. We have research surveys together with the Cancer Center of the University Hospital of Zurich, because we, again, going back to the saliva diagnostic, we do believe that we have a huge opportunity to be earlier in diagnosing significant issues like cancer issues in patients, and this in-house collaboration, I think that will also bring us to the next level in terms of development.
Okay. Sounds very exciting. Can't wait for it to see. And I think everybody's interested in your simulation that you did with the ETH on the short dentistry.
I should do this as well.
Exactly. So, Ronnie, last chapter maybe for today's podcast, a topic that is close to my heart and very close to your heart as well, the ITI. You know, you just been announced last year to be the president-elect of the ITI going forward, which is a big honor, and it's not your first big role leading big associations to success. You're also the president of the EAO currently. So, what is your vision on the ITI going forward? You know, what is and what is the contribution the ITI should bring to dentistry? Let's say in the framework of the vision of dentistry you just presented before.
Mm-hmm. Thank you very much. No, it is a big honor, and I'm very excited about that. But again, most important, I don't look forward just to be the president. I always said, I had my inauguration speech then in Singapore and said, I will never be the ITI president. I will always be Ronnie, because I don't want to put myself into the position of the president. It's not about the president. It's about the vision of the ITI. And with the ITI, we have an enormous opportunity, being the largest network in implant dentistry, being present in every continent, in so many countries. And my true passion is, again, to bringing this understanding and the responsibility of the dentist for the oral health into this global setup. And on the bottom line, the true passion I'm following there is really to provide more patients with better care. That should be our overall aim. And I do see that needs to be done, again, on multiple levels. So starting with student education, then on young dentists, on a curriculum-based education, then also on advanced dentist education. So we need to rethink the way how we make congresses, how we educate people in a completely different way. And I have a strong focus also on developing countries in order to have there really to provide these dentists with the right values, the right tools, in order to really get more patients into an environment where they have been professionally and taken care of for their dental and oral health.
Okay, really looking forward to this, Ronnie. Maybe one last question on the ITI would be for me then, how do you see the ITI being supporting the young generation of dentists that I think, you know, is somewhat the future and needs our support in developing, let's say, significant clinical skills?
Mm-hmm. This is anyway a passion the ITI was always following, and I think that is also one of the true successes of the ITI over the years, because it was always engaging also with the young ones. It was not an elite type of organization. I think that's very important. And for me, leading the ITI is also trying to lead it with providing the dentist with the positive energy in dentistry. It should be a feeling. It should not just be a belonging. It's a journey which you do together, and sharing the same values. I think that's an important part. So I want to change it not just to an education or a lecture or congress type of organization. It should be at the end a feeling and an energy which creates globally among the dentists.
Yeah. So true community and family. Yes. Ronnie, this brings us already to the end, and we have a routine question also at the end. You know, if you could invite any person that you are aware of, living or not living, to an evening-long fireside chat, maybe accompanied with a good glass of red wine, who would you invite for an evening-long inspirational conversation at the fireside?
At the current situation where we are right now, I would be really interested in having a discussion with Elon Musk. I think it's one of the craziest person in the world. It's one of the most successful person in the world, and being able to listen once to a person like this, what he personally thinks about dentistry, that would be really something which would be definitely inspiring. Maybe it would be a nightmare, but it could be both, because he's definitely a firecracker which can go in one or the other direction. I have not a lot of admiration for him, but I want to understand people like these, which are so disruptively successful, how they actually think.
A very, very, let's say, polarizing personalities that might be extremely interesting to hear their opinion. So, Ronnie, this brings us to the end. First of all, I would like to thank you very much for spending time with us, being part of this podcast. It has been a great learning journey for me personally. So, we have been in contact for the last 2 decades very often, but I still learned something today. And for this, I would like to thank you very much for your openness and also your honesty that you bring actually every day to the table. So thank you, Ronnie. Now to our listeners, I hope this was also inspirational to you. As always, if you have questions, then please post them on Instagram or let us know by sending us a direct message. And keep looking for the new episodes of this ProTalk podcast. And we hope to see you soon in the next version. So thanks a lot for being part of this.